Hello everyone, welcome to third video of NEET-PG 2023 recall question discussion. So starting with question number 21, a medical student, female, presented with repeated episode of breathlessness, palpitations, sweating, hyperventilation and feeling of impending heart attack or feeling of doom. So 5 to 6 episode in last 6 months. So which is the most likely diagnosis in this case? Number 1 is generalized anxiety disorder, GAD, panic disorder, depression. So what is the most likely diagnosis? So feeling of doom, recurrent episode with breathlessness, palpitation. It is classical example of panic disorder. So the answer of this question will be panic disorder. Next question, coming to question number 22. Injury at which point causes loss of dorsiflexion of foot? As all of you know, loss of dorsiflexion, in other words, it is nothing but foot drop. In case of foot drop, the patient will be unable to dorsiflex his foot. So this is foot drop. And which nerve injury causes foot drop? Yes, you are absolutely right. That is common peroneal nerve. Common peroneal nerve injury causes foot drop. Common peroneal nerve or deep peroneal nerve. So common peroneal nerve passes just by the side of neck of the fibula. So here the answer will be injury to this side. Option C. Option C is neck of the fibula. So injury to the bone near neck of the fibula causes loss of dorsiflexion of foot or foot drop. So the answer is option C, neck of fibula. Coming to question number 23, a 6-year-old child presented with fever, rash, coryza. On examination, Koplik spot was found. Straightforward question, what is the diagnosis? As all of you are familiar with this image, this is Koplik spot. Koplik spot is found in patients with, yes, it is measles. Measles, the rice granules just opposite to second or first molar tooth. So this is Koplik spot and this is found in measles. So the answer of this question is measles. Typical presentation, fever, rash, coryza, conjunctivitis, maculopapular rash and along with Koplik spot. So diagnosis is measles, not mumps and rubella. Next, coming to question number 24, husband and wife presented to OPD with complaints of premature ejaculation leading to frequent interpersonal conflict. So what will be the most appropriate non-pharmacological treatment for this patient? The most appropriate non-pharmacological treatment for this couple will be squeeze technique. This is applicable for all patients with premature ejaculation. Most appropriate treatment for couple, squeeze technique, non-pharmacological method. So answer is squeeze technique for premature ejaculation. Coming to question number 25, baby of primigavida presented with hearing impairment or hearing loss, visual loss with bilateral cataract and cardiac abnormality, congenital cardiac defect, PDA. So what is the likely diagnosis? This is the classical triad of congenital rubella syndrome. As all of you know, congenital rubella syndrome presented with cochlear defect or bilateral sensory neural hearing loss, cardiac defect, most commonly PDA or pulmonary stenosis or cataract. So these three common triad is seen is congenital rubella syndrome. So the answer is congenital rubella, not congenital varicella, not congenital CMV, not congenital toxoplasmosis. Next, coming to question number 26, reliable investigations to detect rotavirus infection in a child. It is definitely antigen detection in stool. Very straightforward question. Rotavirus, one of the most common cause of diarrhea in children. So the most appropriate or reliable investigation, antigen detection, rotavirus antigen detection in stool. Coming to question number 27, 40-year-old male, chronic alcoholic presented with confusion, ataxia and nystagmus. What is the likely diagnosis? So this is the classical triad, confusion, ataxia, nystagmus. As you can see, this is triad of Wernicke's encephalopathy. As the option hints are given, chronic alcoholic. As alcoholic men are always deficient in vitamin B12 or thiamine, this may cause Wernicke's encephalopathy. This is triad of altered mental status, ataxic gait and ophthalmologia, maybe sixth nerve palsy and all. Sixth nerve palsy, nystagmus can be found because of ophthalmoplegia. So this is classical triad of Wernicke's encephalopathy. So this is the answer, not Korsakoff cyanosis, not delirium tremens, alcohol withdrawal syndrome, not de-Clermont syndrome. Next, coming to question number 28, patients with fever, chills and right upper quadrant discomfort. On examination, patient is icteric, and true statement about this condition. This is very important image. This is nothing but water lily sign. In which condition it is seen? Yes, this is seen in hydatid cyst, water lily sign. So water lily sign is, or also known as cameloid sign, is seen in hydatid infection where there is detachment of the endocyst membrane causing appearance of a water lily. So this is water lily sign of hydatid cyst. So the true statement, surgery always mandatory, absolutely no. Causative agent is Echinococcus. Yes, causative organism is Echinococcus. And aspiration for diagnosis confirmation, definitely no. So the causative agent is Echinococcus. Coming to question number 29, what complication is most likely to occur in this patient in long term in given scenario? This is congenital melanocytic nevus, and the most important long term complication that may happen in this condition is malignant melanoma. So malignant melanoma is the right answer, congenital melanocytic nevus, nevus of Ota. Coming to question number 30, alcoholic patient, history of fall presenting after 1 week with confusion. This is the typical history. Do not just mark it by seeing the image. The typical history was given, alcoholic after trauma 1 week he is presenting with confusion. This is classical presentation of subdural hematoma. The CT image was also showing subdural hematoma, and the classical presentation of confusion after 1 week of trauma. So this is concavo-convex shaped hematoma, and presenting with confusion after 7 days trauma. So this is subdural hematoma or SDH. So thank you very much for watching. In the next video I am going to discuss question number 31 to 40. Stay tuned.